Today I want to go directly to the controversial topic, whether BDS can do cosmetology or not.
We have to follow whatever the DCA has to say. Many doctors in India don't know the maxillofacial surgery department.
If a 12th pass person by authority of India is allowed to do cosmetology, then why BDS can't do it?
This is called a skin technician course. There is very controversy regarding who should do, who shouldn't do. BDS are very well trained in the head and neck region. See, whatever our Dental Council of India gives, we have to follow.
And I went to this dermatologist who is very well known. She did the diagnosis. But some other person came. She told me that I'm a therapist.
It is again unethical and illegal.
Why are they fighting with each other?
Dentistry is a dynamic subject.
Article 19(1)(g). A dentist can practice any other profession of their choice with necessary training and statutory approval. Welcome to the today's podcast. This is Dr. Prathmesh, and in this episode we have Dr. Bhargavi ma'am, who is a practicing oral and maxillofacial surgeons with 25 years of excellence and practice in the industry. In this episode we are going to talk about the cosmetology. We are going to talk about the dermatology. If BDS can do the cosmetology or not, what should be the boundaries of each cosmetologist and dermatologist, and of course oral and maxillofacial surgeons. Of course we have talked about the controversies related to dentistry. This episode personally is gonna be very insightful and very knowledgeable for you guys. So grab the attention and enjoy the podcast. Hi ma'am, welcome to the podcast.
Hi,
Thank you so much for
Prathmesh.
joining in. And today I don't want to discuss about the things that are being talked usually. Today I want to go directly to the controversial topic, whether BDS can do cosmetology or not. Because recent times, someone with a degree of dermatology has said very bad things about dentistry. And personally, when I saw it, when I heard it, I felt very bad. What is your opinion on it?
As per DCI guidelines, we have to follow whatever the DCI has to say to practice ethically and legally. So it has given the guidelines on 6th June 2022, stating that dental specialty, which is oral and maxillofacial surgery,
Okay.
these surgeons, OMFS surgeons, can do facial aesthetics and hair transplant. And also it has given some guidelines like what should be the setup, how a hair transplant theater OT should be there, and with all the guidelines it has given. So as of now, we have to follow the DCI guidelines. That
Okay.
is, maxillofacial surgeons should perform facial aesthetics and hair transplant.
Okay.
Now, the main point is many public or almost even many doctors in India don't know the maxillofacial surgery department. There is a specialty in dentistry.
How maxillofacial surgery is different than BDS?
Oral maxillofacial surgery is one of the postgraduate departments or specialties after doing BDS.
Okay.
So we have many departments like root canal specialists who are called endodontist, clip treatment. I'm using the layman word so that everyone can understand.
Yeah.
So braces, who keeps braces is called an orthodontist. Likewise, one of the clinical specialties which is very near to the medical field is oral and maxillofacial surgery.
Ji.
So we undergo extensive training program in our post-graduation, starting from the basics of the human anatomy till oral cancer reconstruction procedures.
Okay.
This is the extensive training we go through.
There is a program that is being run for like a diploma of cosmetology for people who are 8th pass, 10th pass, 12th pass. And what I could see there is they can do Botox, they can do chemical peels, they can do different type of cosmetological procedures except a hair transplant. If a 12th pass person by authority of India is allowed to do cosmetology, then why BDS can't do it?
This is called a skin technician course.
Okay.
These are trained to assist the doctors.
Okay.
So technically they shouldn't perform any of the procedures on the patient.
Okay.
This course is only to assist
Okay.
the doctor. Actually, there are no guidelines or proper norms for cosmetology or facial aesthetics. But as per dictionary, cosmetology is something superficial, which can be done to the skin, nails, and some artificial makeup. But facial aesthetics is something more deeper. It has both invasive and non-invasive procedures. And there is an overlap of all these procedures also, wherein chemical peels and also some lasers are coming to picture.
Ji.
So that's why there is very controversy regarding who should do, who shouldn't do. And
Okay.
since BDS are very well trained in the head and neck region and also the mouth region, it is obviously we thought, the dentist thought that it is their horizon too.
Ji.
Till 2022, there were no norms at all.
Okay.
Everyone is getting trained, taking few courses, international courses, and doing the procedures. Since 2022, the norms have given by NMC, which is a governing body for the medical doctors, and DCI also gave the guidelines.
Okay.
See, whatever our Dental Council of India gives, we have to follow.
Okay.
After a few years or some time, if Ayush governing body gives that they can also do, maybe they can do. We will be following only DCI.
Okay. So now there is one BDS person. Okay. And he is going for the diploma that is being available as cosmetology, which is governed by Government of India. So now I think doing chemical peels, doing procedures that are not too invasive should be done by BDS, but with association with some dermatologist or some maxillofacial surgeon under them. Because I'll tell you why I feel it.
Yes.
I went to this dermatologist. As you can see, there are some scars on my face. And I went to this dermatologist who is very well known in this place. I went to her. She did the diagnosis, primary diagnosis. She told me that you have to go for MNRF and PRP you need to do. I said, okay, I'll do it. I went inside the room for the first session. She came. She was like, okay, we are going to do it. But some other person came and she did the whole procedure on me. And I asked her about what is your qualification and all. And she told me that I'm therapist. So if therapist is allowed to do this dermatological procedures under dermat, then why can't the BDS do under some maxillofacial surgeons?
Technically, even those therapists shouldn't do even under
Exactly.
dermats.
Yeah.
It is again unethical and illegal.
Yeah.
It is called again quackery. Assistants should assist. They shouldn't perform any of the procedures under any dermat or any maxillofacial surgeon.
Okay.
So what you went through is quite a quackery thing, which shouldn't be done.
But it is being done in the most of the cases, ma'am. Like I told it to someone else as a my cousin is dermatologist, so I told her that this has happened, and she's like, yeah, this is what happens because one dermatologist can't do many of the procedure because it takes 1.5 hour, and not every dermatologist is gonna serve hundreds of the patients. So this is the way they have found.
See, since it's a cosmetic procedure, we are taking it lightly.
Right.
When a surgeon does, if I'm doing any trauma case, I cannot, since it's been almost 2 hours, I cannot leave it to any of my assistants to continue the procedure and suture it. I cannot say that. So the procedure should be done only by the respected doctors. That's it.
Right. Very
But
true.
assistant only should assist. Just because it's only some peel or something else, you cannot leave it to your therapist or any other assistant to perform the procedure.
True.
It is absolutely unethical and it comes under quackery only.
Okay.
In such a case, if there is any complication for that, we can file cases regarding that.
But ma'am, there is a syllabus that a BDS person goes through. Let that be pharmacology and let that be any other subject.
Yes.
It is not different than an MBBS person.
Why dental is kept separately, not included in the medical, is because of its vastness.
Exactly.
So that is the reason why we study for 4 years plus 1 year of rotatory internship.
Ji.
The anatomy of the body, there is no separate pharmacology or physiology for head and neck and for other parts of the body. It's just common sense and we can see in the syllabus. We get trained, all the dentists get trained in their graduation in the mouth and perioral region. Okay. Now, whether they can perform the cosmetology or not can be considered by the government of India
Okay.
because Dentistry is a dynamic subject.
Right.
And treating, see, if an aphthous ulcer comes on the lips, you cannot send it to some other medical specialty.
Right.
Aphthous ulcer on the lips or perioral region can be treated by a dentist.
Yeah.
I'll just tell you one example.
Please.
See, if we have a trauma case, facial trauma in a road traffic accident or something else, we suture, we plate the bone, suture everything.
Right.
And coming to the skin, we don't call any skin specialist for suturing. We do it ourselves. That is to say, the anatomy and the physiology and the skin lines, everything, we are well taught, well trained, well skilled.
Right.
So, even in the oral surgery, oral pathology textbooks, which are the basics, oral medicine, we treat all the perioral, head and neck, face diseases and something. And cosmetology is not invasive procedures, frankly. I think it is time the government can think about it.
Yeah, that's what I actually feel.
Oral maxillofacial surgeons who are ethically and legally allowed to do facial aesthetics and hair transplant are termed under dentist, and they are being targeted.
Yeah.
Which shouldn't be done.
Okay.
Maxillofacial surgeons are surgeons.
Right.
BDS, Bachelor of Dental Surgery. We don't have any Bachelor of Dental Medicine. From the day one, we have Bachelor of Dental Surgery.
Right.
That is to say, from our first year, we are surgeons basically. But few of the specialities in medical fraternity, they don't have a specialization, though they are considered as physicians.
Exactly.
They perform few procedures, claiming that they come under, it is their own territory. This overlapping is there worldwide.
Right.
Overlapping of the branches. This is our zone, this is our zone, you shouldn't enter. It's something like that.
In my opinion, ma'am, what I'm seeing right now is lot of cosmetologist and dermatologist. It's like cosmetologist versus dermatologist. But what I think is, why are they fighting with each other? While it should be a synergism between the dermatologist and cosmetologist.
Yes.
A cosmetologist will do the minimal procedures.
Yes.
And they are not like fighting like, okay, we will treat diseases, psoriasis and all. They are never into that.
Yes.
Like what, in my opinion, I have seen many of the cosmetologists, dentists turned cosmetologists, and I have not seen anyone who is like claiming that I can treat psoriasis,
Exactly.
I can treat diseases. In fact, a lot of people with the cosmetology degree, they know their limits. It's not like they want to do transplants. It's not like they want to do something that is invasive. They know their limit. Okay, I can do this. I can do that. And I get it, because when you can give local anesthesia in such dangerous regions,
Yes.
you can definitely do face PRPs and all, definitely with some training, of course. So what I think is, dermatology is very vast. A very small piece of it is considered into the cosmetology.
No dentist is doing any skin pathology.
Yeah.
Here, dentist means, now I'm stressing, it's oral and maxillofacial surgeon.
Right.
Because many people doesn't know maxillofacial surgery department is there.
Right.
So, we maxillofacial surgeons, called as dentist by public,
Ji.
they can do. Okay. And we need not fight. Any medical fraternity shouldn't fight. They should go hand in hand, take each other's help and everything.
Right.
During this COVID time, as you know, we have many black fungus cases, mucormycosis cases. It is we maxillofacial surgeons who reflected the maxillary flap and paved the way to the skull base.
Ji.
So it was very easy for them to perform those procedures.
Right.
So we helped that much. That is our what you call skill training and everything. And I'm telling you 100%, there is no dentist who is performing hair transplant.
Yeah, true.
Whoever is doing cosmetology, they are only doing, I think, only facials, which are done by some all spas and everything. Since we are all doctors, we should follow the DCI guidelines. Till then, we have to follow whatever DCI guidelines say.
Followed, yeah.
My advice, BDS people who are into cosmetology, give a representation to the Dental Council of India. ask them to clarify what the procedures can be done and which
Yeah.
are shouldn't be done.
Yeah. Rather
Then I
than
think
rather
fighting
than
and
exactly.
going through these disrespectful things on social media and public and patients asking them, I don't think it's
Right.
the correct procedure.
Right.
And worldwide, and especially in India, the number of skin diseases has come down.
Right.
So, and nowadays, everyone wants to be in aesthetic zone,
Exactly.
risk-free, disease-free zones.
Yeah.
See,
Which has a great market, by the way.
market in income-wise.
Yeah, biggest global market of this
Yes,
year.
yes. And within few years, I think India is going to be in trillions, in trillions for this
Yeah.
treatments and everything. So I think everyone is fighting for that. Instead of fighting, let the government decide the guidelines, and
Yeah.
let everyone has their own clientele.
Even I feel that rather than asking if cosmetologists should do it or not,
Yes.
rather than that, there should be a line.
Yes.
Okay, cosmetology people can do until this procedures.
Yes.
From there, this maxillofacial surgeon comes,
Yes.
and there are few procedures, of course, which maxillofacial surgeons can do, like psoriasis and all. They're the dermatologist will
Even the
come.
maxillofacial surgeon doesn't treat any of the skin
Exactly,
disease,
right.
any of the skin disease, because we ourselves are very busy with our own trauma cases, orthognathic cases, oral cysts and tumors, facial cancers,
Too
and
many things.
reconstructive procedures, and as usual, facial aesthetics and hair transplant. When compared to all these procedures of the head and neck region, the disease part, this facial aesthetics is comparatively less risky for oral and maxillofacial surgeons. We perform these oral cancer resections and reconstructive procedures for almost 7 to 8 hours continuously. And the results are very good. I can say with maxillofacial surgeon doing these procedures is very, very beautiful and very good.
Right.
The success rate is very high.
I have seen few cases
Yes.
done by maxillofacial surgeons, and I can advocate for that. Now, ma'am, I want to ask you a very quirky thing. So, I do implants now. I go to some consultations, even though they know a very small idea of implants, they have put their dentist clinic as does dental and implant center, and they are asking me to come there. So, logically, I'm going there if there is a patient. Since I'm going there, they have put the implant center.
Yeah.
So, can a BDS person with professional training of cosmetology, if they get consultants which are oral and maxillofacial surgeon or maybe the dermatologist, can they also put dental and skincare, whatever?
As per, we have separate rules for a clinic.
Okay.
So that comes under DMHO, District
Okay.
Medical and Health Office.
Mhm.
Okay, the DMHO is the governing body for the clinics and hospitals.
Okay.
So for a dental specialty, if you want to go for other specialties like again skin and everything, this DMHO is considering skin or cosmetology as a separate medical department. So even if you do course and if you have some knowledge also, it is not allowing to keep that name.
Okay.
So supposing if it is a oral and maxillofacial surgeon doing facial aesthetics and hair transplant, then we have to keep it under as multi-speciality
Okay.
because DCA has given permission.
Hmm.
But a BDS person cannot do that as of now.
Do you think government should reconsider this?
Yes, because see, the world is fast changing.
Hmm.
In other countries like US, UK, Canada, and Australia, and other Spain, Italy, everywhere, dental surgeons are doing cosmetology.
Exactly.
But those courses are not valid in India. So even the constitution has been amended n number of times till date. So we have to reconsider, even in the medical field also. In our dental field, we have to, the government can consider what is trending. They have to consider the skills and worth and training of our dentist, and I think they can reconsider and they can form guidelines accordingly. See,
Right.
small procedures, they can perform non-invasive procedures like some facials or something like that, because no dentist treats any pathology.
Right.
Even though we have knowledge We don't do that.
Right.
See, if any ulcer, any papule is there on the forearm,
Mm-hmm.
they send to some dermat.
We ourselves
That's
will
it.
go to
Since we will send.
Right.
When I started this hair transplant and facial aesthetics, people came to me asking for disease treatments also.
G.
I straight away told that we don't treat diseases. Skin
Exactly.
diseases we don't treat. So we treat only facial aesthetics and hair transplant.
Okay.
So we have clear knowledge and we clarified everything.
Hmm.
So it's if someone says from any other fraternity, medical fraternity, or anyone says that how can DCI give guidelines, something like that, that's pure ignorance.
Right.
Because our governing body is DCI, Dental
Right.
Council of India. We follow what Dental Council of India says.
Right.
Ayurvedic doctor follows what their body says.
Right.
They don't follow what DCI
Yeah,
says.
that is the
It's
utmost.
just simple common sense, that's it.
Right. I just want to enlighten you on this article 19(1)(g). A dentist can practice any other profession of their choice with necessary training and statutory approval.
Yes. See, we have in the constitution and in the legal body
Right.
are two different things.
Hmm.
The constitution frames that we can study or do whatever you want, an
Okay.
individual wants.
Hmm.
So when if you are a professionally doctor,
Hmm.
you have to go according to the council, whatever your council says.
Right.
See, we have loopholes, we have amendments, sub clauses, and everything.
Right.
So legally, we have to follow. That's what I have been telling you.
Hmm.
We have to follow our governing body. That's it.
Right.
Recently, I think few years back, we can also study law. Previously, it was not there.
Okay.
Now we can study and we can even practice. That statement should be given by the government. Some GO should be passed by the legal department, not by the DCA.
Okay.
So even you're a doctor and an advocate, you can do both. But these two are coming from two different bodies.
Right.
So accordingly, there are again sub clauses to it.
Hmm.
As an individual, you can do whatever you want
G.
under jurisdiction, under legality and everything.
So from what you have said, in Australia, UK, dentists can do cosmetology, but not in India, right?
Yeah, various people can do when they get permission from the DCI.
Hmm.
See, when you are doing something good, when you are doing your own practice, professional practice, you shouldn't hide and do some chup chap करके ऐसा करने की जरूरत नहीं है.
Hmm.
You should do it boldly.
Right.
That comes only with the guidelines from our governing body.
Okay.
So once it is there, you can do very good treatments and you can deliver very good services to the patient.
Okay. Do you think dentists are capable of such treatments?
Obviously, they have studied for 4 years and 1 year of internship. See, dentists are dental surgeons who directly do treatments on the patient and in the mouth, which is the gateway to the body,